I've been working in the ER for 25 years. For a long time, I thought I needed a medical kit in my car, but it was always one of those get around to it projects. Then two things happened that increased my motivation. One of the docs I work with was involved in a really bad motorcycle accident, and one of our other docs just happened on the scene and held his C-spine until paramedics arrived. Then one night I was driving home late at night and I came across an accident where a car had struck a farm tractor on a 2-lane road near my house and there was debris everywhere. I was able to roll down the window, talk to the driver and passengers, see if they were okay, and they said they were fine and could wait for the ambulance to arrive, and we could already hear that ambulance coming in the distance. Both of these incidents made me realize that thinking about it wasn't enough. I needed to finally get on it and be ready. Now, there are a lot of pre-made kits you can get from places like North American Rescue, which I think is one of the gold standards for quality medical equipment. However, the advantage to making your own kit is that you can customize it to your specific level of training and your environment. But having gear is only half the battle. If you really want to be ready, I highly recommend finding an in-person course for basic first aid or courses like Stop the Bleed or Beacon, Bleeding Control, because data shows that in-person training jumps your success rate with a tourniquet from about 20% to nearly 90%. And hemorrhage accounts for almost half of the preventable trauma deaths. Even in a big city where fast response times, over a third of those deaths happen in the first hour, and that is exactly the window this kit is designed to address. I know some people are hesitant to get involved because they're worried about the legal side of things, but know that all 50 states have Good Samaritan laws to protect people who provide emergency care in good faith, so don't fear the lawyer hiding under every car to stop you from doing the right thing and potentially saving a life. For me, I live in a metropolitan area where ambulance response times are usually just 5 to 10 minutes, and a trauma center is always nearby. I don't need to be prepared for hours of wilderness medicine. I just need to bridge that gap until paramedics arrive. Because of that, this isn't a boo-boo kit with dozens of band-aids. My goal is to create a compact kit that focuses strictly on managing major life-threatening problems for those few critical minutes. I built this kit around the North American Rescue door panel bag. It is a 7x7-inch bag designed to fit right in your vehicle's door storage bin or your glove compartment. It has a carry handle on top here, 2 zippers with paracord zipper pulls. On the inside, it has a pocket with mesh so you can see your items, as well as some elastic straps to keep everything organized. I'll put links to everything I'm about to talk about below. And look, as much as I wanted to give you all Amazon affiliate links for my own benefit, I couldn't do that in good conscience because some of the gear is actually cheaper on the North American Rescue site. So I've included links to whichever price was lower. Before we dive in, a quick reminder that step 0 is always scene safety. Before you even step out of your car or move in close to any kind of accident scene, check for oncoming vehicles, fuel leaks, unstable vehicles, anything that might be dangerous to you because you can't help someone if you become the second patient. Also, this is not an instructional video. While I will talk about some of these items in general terms, the point of this video isn't on how to save a life. That is a topic for a different video and or requires some additional training. Looking into this kit, there are a couple different categories of things that I have in here. The first category is massive hemorrhage and trauma. First item I have is a CAT tourniquet, or a CAT. CAT tourniquet stands for Combat Application Tourniquet, so saying CAT tourniquet is redundant, but people often still say it. There are plenty of good tourniquets out there. Pick your favorite, but I decided on a Gen 7 CAT. Tourniquets are the gold standard for life-threatening limb bleeding, and research has debunked the old myth that you will lose a limb by applying one of these, especially for the short time it's going to take for an ambulance to arrive and get to your nearby trauma center. And also, one vital tip, take this out of the plastic wrapper that it comes in now, because fine motor skills will degrade rapidly under stress, and trying to pick at that plastic is the last thing you want to do, especially if you are trying to apply this to yourself. Also, when you get the tourniquet, stage it for faster application. Again, past the point of this video, there are plenty of videos on how to do this, but when you get it, stage it that way when you go to apply it to someone, you can just open it and put it right on them. Compressed gauze, this is $4 on the North American Rescue site, nearly $9 on Amazon. It's designed to maximize surface area to promote rapid clotting through mechanical pressure. You shove this into a wound, and pro tip, if you want to level up your game, you can look into hemostatic gauze impregnated with clotting agents. It is more expensive, but it can significantly augment the hemorrhage control. Especially for junctional wounds in the neck or the armpit or the groin, you pack this in there, and those are places that a tourniquet will not work because you can't apply a tourniquet to any of those places. 4-inch flat ETD. This is an emergency trauma dressing. It has an ACE wrap and the dressing. This provides circumferential pressure to help stabilize the clot while you're moving a patient. This will wrap around and stay on the patient. Hyphen compact vented chest seals. These are used for open chest wounds. For the most part, if you see a chest wound, you can apply a seal to it, but tension pneumothorax, which is the big thing that you worry about, the physiology of that is outside the scope of this video, but the vented seals have less risk of contributing to a tension pneumothorax. If air can get into the chest but can't get back out, it builds up pressure, collapses the lung, and can lead to death, and the vented seals help allow the air to escape. But even with a vented one, you still have to monitor the patient constantly. If the breathing gets worse after you apply the seal, you have to be ready to loosen it or remove it immediately to vent that pressure. That single move can be life-saving. Chest seals are not a set it and forget it item. Next category is airway and protection. I have a CPR microshield mask. Current guidelines suggest that if you are a trained rescuer, you should perform both compressions and rescue breaths. But if you're untrained, you should focus only on quality compression. The one-way valve in this mask protects the rescuer from the patient's secretions because a lot of people might be a little reticent to put their mouth on a stranger's mouth. Trauma shears. As I explained to all of my students, medicine happens at skin level. I have seen so many things missed by not looking directly at the skin. And this is why trauma patients get all of their clothes cut off when they get to the hospital. You can't treat what you can't see. You need these to get through seatbelts and heavy clothing quickly so that you can see what is happening at skin level. Nitro gloves. I keep a few pairs in here. And as much as people think it's cool, don't get these in black because you can't see blood on them during a blood sweep. Red blood on a black nitro glove is virtually invisible at night. Get blue or some other high-vis color and get them in your specific size. I wear a medium. And really, while you're doing this, go ahead and get a whole box because they're useful for all sorts of things around the house. Cleaning your guns, painting, cleaning the chicken or the turkey. Just buy the whole box. Lots of uses for these. Category 3, burns and other essentials. I have a Burn Tech 4x4 dressing. Burns are super painful, and this is a cooling hydrogel dressing that can provide some relief until EMS arrives. And since it's hydrogel, it won't stick to the wound like dry gauze, and that will prevent further tissue damage and trauma and pain when it's eventually removed in the ER. Tapes, I got some Gecko Grip flat tape because it is so compact, but admittedly, tape is going to be a short-term use item. It's going to be taken off for wound evaluation pretty quickly, either by the paramedics or when they get to the hospital. You could just get a roll of transport tape because it is cheap and easy to use and easy to tear when your fine motor skills are shot. A Sharpie to mark the time on the tourniquet that you applied it. Tourniquets have this spot right here that after you put the tourniquet on, you put this over, you write the time right here, because in a chaotic or even a normal scene, I can tell you that your verbal report can get lost. And documenting the exact time that the tourniquet was applied is critical because tourniquet complications are time dependent and that hard copy of the information impacts the surgical decisions we make at the trauma center. Medic cross patch. I swapped out the standard gray North American Rescue patch for this red woven patch just because I think it was better looking. A Rescue Me window breaker. If someone or you yourself are trapped in the car and you need to break in or break out, you use this, you push it onto the window, it will break the glass. It also has a seatbelt cutter here. You can use this to cut the seatbelt to get people out. This is just a small compact item that even if you don't have a big kit, you can get one of these and leave it in your car. Might save yours or someone else's life. If you have a little more room in your bag or your vehicle, there are a few upgrades you could consider. Upgraded pocket mask. Well, I carry that CPR micro shield because it is so compact. A true pocket mask is a significant upgrade. It does provide a much better seal on the patient's face and can provide more effective ventilation. For environmental protection, you might consider adding a Mylar emergency blanket or a space blanket. There is the trauma triad of death, and hypothermia or being cold is a third of that triad as it drastically increases mortality in trauma patients. Remember that once you use those trauma shears to cut the patient's clothes off to find a wound, they are going to be exposed and may lose heat fast. And a $5 space blanket can help prevent that heat loss. Again, considering the time of the year and ambulance response time. Narcan. These days, naloxone or Narcan nasal spray can be a roadside essential. You would be surprised how often an opiate overdose is the primary cause of an accident. I have seen people, and I do not understand this at all, but they will be at a light, and for some reason they overdose at the light, and because they pass out, foot comes off the brake, and they will ease maybe just onto the curb. And they're not in a bad accident, but they're not breathing, and the Narcan can revive them from that opiate overdose. Or they come off the brake and they slowly go into oncoming traffic, and they're now both in a bad accident and they've overdosed. And this Narcan nasal spray is compact, it's shelf stable, and it requires zero special training. Lighting. Throw in a small flashlight, or better yet, a headlamp, because much like cutting the clothes off, you can't assess what you can't see, and the ambient lighting at a crash scene at 2 a.m. is usually non-existent. I do carry a flashlight with me all day, every day, but if you are not someone that does that, add a flashlight to your kit. One last piece of advice on maintenance: don't just make your kit and forget it. This is not a set it and forget it kit. Periodically inspect your kit, because things like hemostatic gauze, the hydrogel burn dressings, and chest seals all have shelf lives, usually 3 to 5 years, and you want this gear to work the one time you actually need it. And finally, this setup is designed to be lean. I stripped out the bulky bandage packs and chafing ointments because in a real emergency, that stuff just gets in the way. I did just include a few 4x4s and some bandage just because they are so small, but for the most part, this is not a boo-boo kit, as I mentioned. This is for dealing with major life-threatening trauma. This kit stays in my door or in my glove compartment, depending on the car. I hope to never have to use it, but after 25 years in the ER, I am glad it's there. Check out the video description below for links to all of the items I mentioned. Also, add some comments if you have any ideas for additional items. Appreciate you watching this video, and I do have a few other car medical videos coming up, so I would love to see you in those.